That time of the year again when everyone seems to be coughing and sneezing. And yes, doctors we spoke with today say they're noticing an increase in illnesses including flu, RSV, norovirus, and pneumonia.
Our Rachel Ripp joins us in studio tonight to share the stats with us that she's had to collect today. Rachel, what's going on?
Yeah, that's right. Norovirus, I should say specifically, is something we're hearing a lot more about this year. Well, according to data from the CDC, the number of outbreaks are higher this year than they've been in the last 11 years.
We all know getting sick is more common this time of year. And right now in the Midlands, doctors are noticing specific increases in flu, RSV, pneumonia, and norovirus. With norovirus specifically,
we're talking about it this year because there seems to be about double the number of cases that we normally see each winter. And combined with the fact that flu season this year has also been a little bit more intense, it just is helping the community and people understand, hey, if you're sick, there's a whole lot of other people sick.
Dr. Brenna Brooker is the chief of emergency medicine at Lexington Medical Center. She says right now she's very frequently seeing multiple cases of suspected norovirus during her ER shifts.
Norovirus is a virus, and it's really, really contagious, which makes it be one of the extremely common things that we see in winter when people are close together. And it lives a long time on surfaces. And unfortunately, the hand sanitizer that kills a lot of other viruses doesn't get norovirus. When you see the bottles that say kills 99.9% of viruses, unfortunately, norovirus is not one of those viruses.
She says the best prevention is hand washing, washing your fruits and vegetables, and regularly disinfecting doorknobs and handles. If you do catch it, Dr. Brooker says the symptoms are vomiting and 4 to 8 episodes of diarrhea. Then you'll be sick for 2 to 3 days, but she says you can stay contagious for 2 days after, and even have norovirus particles in your saliva or stool for up to 2 weeks. Dr. Brooker says you'll need to visit her in the emergency department if you're weak and not able to keep food or liquids down. As for other illnesses,
this year, in general, we've had a really bad mycoplasma season. So typically, mycoplasma is that bacteria that cause what we traditionally know as walking pneumonia. But this year, it seems like it's been a little bit more severe.
It's a bad flu season. It's a normal COVID season. It's a bad RSV season.
the best advice these doctors can give?
Protect yourself, protect others, get vaccinated and wash your hands. Before you touch anybody else and before you touch your eyes, your mouth, or your nose, wash your hands or don't touch your face.
And if you are one of these unfortunate ones, if you do catch norovirus, these doctors say after about 5 days of being sick, make sure you wash and dry your towels and sheets on the highest heat setting for the longest amount of time. In studio, Rachel Ripp, News 19 WLTX.